In a nutshell, it is incredibly important for doctors and hospitals who are getting into the collection and sharing of electronic health information to protect a patient's privacy. So to be mindful at all times that this is sensitive data that people really care about, and that protecting its privacy is pretty critical to building the trust in that relationship that will enable patients to disclose information that's sensitive to them, and for them to be comfortable with sharing information in a bigger health data ecosystem. But having said that, there's a lot of myths out there about what you can and can't do under privacy laws, and that includes HIPAA at the federal level, as well as state laws for privacy, like the Confidentiality of Medical Information Act in California. The reality is that those laws were expressly designed to allow information sharing for routine healthcare purposes. So sharing for treatment, sending information to a health plan in order to be paid. All of that is encompassed in those laws and allowed. Some ability to analyze data for quality purposes, and the ability to give patients their own data, to empower them, to help them make their own healthcare decisions. That's all okay in these laws. And the problem is that there's been a lot of myths that have been created that privacy is the obstacle to sharing, that it's more private not to share. And while that is certainly true, it's also not what the laws are intended to do. The laws are intended to enable the health data sharing that's appropriate, that most patients expect, that most patients think we're already doing, frankly, even though we're not. So be very careful when you think, or when you're told, HIPAA doesn't allow that. Because if it makes sense to do it, chances are HIPAA actually does allow it.